The next thing we need to assess is somebody's bowel habits, and this is because our gut health and what our stools are like tells us a lot about somebody's overall condition. Knowing what somebody's normal bowel habits are like is so important in being able to detect whether it's changed or not. And the true answer to what is normal is very variable between individuals. The ideal is that you're able to pass stools easily and that you are able to do that at least every 1 to 3 days without straining. The bowel itself is almost 8 meters long. Your food, which you take in through your mouth, is then digested in your stomach and then passes out into your small intestine, which is almost 6 meters long. This is where the nutrients are absorbed from the food. It then passes into your large bowel, which is 1.5 meters, and this is where water is absorbed and stools are created. If we look at the Bristol Stool Chart, types 1 and 2 represent stool that has been in the bowel for the longest time, containing the least water, and is therefore the hardest kind of stool. This would be considered an amber sign, as it represents constipation. Types 3 and 4 are the ideal kinds of stool, and these would therefore be green, as these can be passed easily without straining. Type 5 stool is sometimes considered to be lacking in fibre. But 5, 6 and 7 all represent diarrhoea, which means that the stool has been in the bowel for the shortest amount of time and contains the most liquid content. These would be red signs because they can indicate infections, and they can also be signs of bowel cancer, particularly if there's blood or mucus. Diarrhoea can also be caused by less serious things. For example, if someone is severely constipated, they can become so blocked up that they pass an overflow of liquid, which we call overflow diarrhoea. Diarrhoea is a common side effect of medications and can also be the result of someone being artificially fed, for example with a PEG tube. However, equally as important is the issue of constipation in our elderly residents, and this would be represented by the type 1 and 2 on the stool chart. The reason is that constipation can have huge impact on somebody's function, particularly in our care homes in the frail residents. Constipation can cause people to fall over, it can increase confusion, it can press on the bladder and cause problems with urine, including urine infections. Constipation can also be very uncomfortable for people and make them in pain, which they may or may not be able to communicate. Constipation is also very much linked to somebody's intake, and we know that it can be difficult to get our residents to drink and to eat enough food and fluids that can help their stools pass out easily. One of the main things that you need to do if somebody is becoming constipated is to look at the fluid and the food that they are taking in, because somebody who's not drinking enough and not eating enough fibre is going to have trouble passing easy, soft stools. Fibre is contained in foods like fruits and vegetables, and whole grains like oats and wholemeal flour. So for anybody who is constipated, it's really important to start monitoring their input and output and to encourage them to stay hydrated and to eat as much as possible.